Microgravity, space radiation, and being in small spaces can all affect the health of any crew in space.
There's an adaptation phase that happens right away when you get up to space. The components of that are some motion disturbances that can lead to basically a kind of motion sickness in some people.
However, retired Canadian astronaut Dr. Dave Williams says motion sickness might not be as severe on Artemis II.
In the Artemis II capsule, we have 330 cubic feet. It's kind of like two minivans. The incidence of space motion sickness tends to be less the smaller the spacecraft.
Over the weekend, the team demonstrated how CPR in space can be performed.
So this is one of our CPR objectives in space.
Further highlighting what the crew can do in case of an emergency.
The level of care is roughly equivalent to what you would find in a primary care clinic or a family doctor's office on Earth. We do have the ability to deliver medical care, but this is not a sophisticated emergency room. It's not an intensive care unit.
The basics cannot be overlooked. For example, exercise is important to maintain muscle function. And while reduced gravity will make the team taller,
we have an S-shaped curve in our back that straightens out if you don't have gravity.
That change needs to be managed upon returning to Earth.
The problem is if you come back to Earth, they compress down to where they were before. And we've actually had astronauts have challenges with that after landing.
Radiation levels will be another thing to watch.
Well, I think if there were solar flares where the overall radiation level were to increase, then you're going to see NASA talking to the crew members about how they can use additional shielding inside the spacecraft to mitigate the effects of solar flares. The radiation effects are going to be important, particularly when we think about going to Mars.
Katherine Ward, Global News, Toronto.